Question 1. 69-year-old man was successfully defibrillated after an episode of ventricular fibrillation secondary to an ST elevation myocardial infarction, STEMI, and transferred to the cardiac catheter laboratory for primary coronary intervention. After the procedure began, he had a further episode of ventricular fibrillation. Regarding defibrillation, which is true? A single direct current shock of 360 joules with a biphasic waveform is the most likely to restore venous circulation. B. Defibrillation is no more likely to be successful than a properly delivered precordial thump. C. It is safe to continue with the coronary angiogram while the shock is delivered to the patient. D. 3 shocks delivered with minimal eruptions should be given before any other intervention. E. 2 minutes of chest compressions before defibrillation is recommended to optimize coronary perfusion. The answer is D. 3 shocks delivered with minimal interruptions should be given before any other intervention. 3 shocks delivered with minimal interruptions should be given before any other intervention. The current version of resuscitation guidelines was published in 2015 with an emphasis on maximizing the delivery of good quality chest compressions. To facilitate this, and to reflect current evidence, single shocks were preferred with compressions continuing while the defibrillator charged. However, in a few special circumstances the option to deliver stacked shocks, i.e. 3 shocks in sequence with minimal delays, should be considered, namely 1. VFVT occurring during cardiac catheterization. 2. VFVT occurring early after cardiac surgery, where early is defined as still in hospital. 3. VFVT arrest where the patient is already connected to a defibrillator. Although there is no evidence to support the use of stacked shocks, it is the opinion of the Resuscitation Council that chest compressions are unlikely to improve the already high chance of restoring spontaneous circulation when shocks are delivered very early in these special circumstances. The 2015 guidelines emphasize minimizing interruptions in chest compressions to less than 5 seconds to attempt defibrillation. The 2015 guidelines on compression depth and rate have not changed. While charging the defibrillator during compressions is safe, conclusive evidence for safety during shock delivery, even with gloves on, does not yet exist. There should be no contact with the patient while shocks are delivered.